Hello, this is a virtual microscopy slide of a case of tuberculous pericarditis. What we are looking at here is the outer half of the myocardium, and this is the very abnormal pericardium. The pericardial cavity has been obliterated by this very thick area comprising necrotizing granulomatous inflammation and fibrosis. Let's first have a quick look at the viable myocardium. This is cardiac muscle, and the nuclei are in the center of the cardiomyocytes. Moving towards the external surface, here is the visceral pericardium, and we can see that there are a lot of inflammatory cells. These are predominantly chronic inflammatory cells comprising lymphocytes, as you can see, with small round nuclei. Here we move into the area of necrotizing granulomatous inflammation. These pinker areas are foci of necrosis in the center of a granuloma. So this whole area would be the epithelioid granuloma with a central area of caseous necrosis surrounded by a cuff of viable epithelioid histiocytes, multinucleated giant cells, and sometimes also lymphocytes. Going back on low magnification, we can see these patchy areas of necrosis in the center of granulomas. And here is one other example, again, with a central area of necrosis. And this is usually where we would find most of the mycobacteria. When we do a Zeal-Nielsen stain, we would look especially carefully in this necrotic area for the presence of mycobacteria. These are the epithelioid histiocytes that form the granuloma. And we have also some multinucleated giant cells. You can see that the nuclei are arranged in a ring or a horseshoe pattern of arrangement at the periphery of the multinucleated giant cell. These are known as Langhans giant cells, and here are some other examples of Langhans giant cells. Here again we can see the nuclei arranged in a horseshoe shape pattern or configuration at the periphery of the cell. Langhans giant cells are often seen in granulomatous inflammation associated with mycobacterial infection. However, they are not specific for TB. They can also be seen in granulomatous inflammation in other infections. Here is a nice example of a Langhans giant cell with the nuclei arranged in a horseshoe-shaped pattern. Sometimes they appear to be arranged in a ring, and this is due to the plane of sectioning of the cell. So moving around, we see lots of these necrotizing granulomas. And in one more example here, we can see the slender, elongated nuclei of the epithelioid histiocytes that form the granuloma. In this area, we don't see granulomas. However, we see this pink tissue, and this is collagen or fibrous tissue with some interspersed blood vessels. And this shows evidence of organization. So in the more acute phases of TB, there is a lot of fibrinous exudates, and over time, this organizes into fibrous tissue. And this is how the pericardial space becomes obliterated because of this inflammation and organization. And this will eventually lead to constrictive pericarditis and potentially heart failure. Let's learn a bit more about tuberculous pericarditis. As mentioned, the disease course has three main phases. In the acute phase, there is usually fibrinous exudation with lots of mycobacteria and both acute and chronic inflammation. In the subacute phase, there may be a lymphocytic pericardial effusion, meaning that there is a pericardial effusion which, when aspirated, shows numerous lymphocytes. And if there is a biopsy taken of the pericardium, this would generally also show necrotizing granulomatous inflammation. In the more chronic phase, as we see here and also in the microscopy slide, there is usually fibrous scarring, sometimes calcification, and still granulomatous inflammation, and this can result in constrictive pericarditis. Grossly, you can see a thickened pericardium, and it really depends on the phase of the disease. Earlier on, there is this shaggy exudate. Here is the parietal pericardium, which has been opened to reveal the visceral pericardium with this kind of grayish fibrinous exudate. And later on, if not treated, there may be obliteration of the pericardial space. There is a separate video demonstrating the gross features. This fully interactive virtual pathology specimen, as well as annotated photographs, can be found in Pathweb, our free pathology online resource. You can register for free, and the link is in the video description. Microscopically, again, this depends on the phases. Usually in the acute phase, we see fibrin, as well as acute and chronic inflammation and necrotizing granulomas. In the subacute phase, we still see necrotizing granulomatous inflammation, and this is the predominant picture. And in the chronic phase, as we see here, there is fibrocalcific obliteration of the pericardial space, and again with persisting granulomatous inflammation. So what we saw earlier is fibrosis and necrotizing granulomatous inflammation. Here is the fibrotic area on top, and these are the necrotizing granulomas. Again, these annotated microscopic pictures can be found in Pathweb. Here is a higher magnification view showing the myocardium and the abnormal thickened pericardium with necrotizing granulomatous inflammation, fibrosis, and more necrotizing granulomatous inflammation. Here is the area of the visceral pericardium where we can see lots of lymphocytes. And this is the area of fibrosis where there is deposition of this pinkish collagenous tissue. And here is a higher magnification view showing necrotizing granulomatous inflammation with central necrosis, a cuff of surrounding epithelioid histiocytes, including some Langerhans giant cells and patchy lymphoid infiltrates. In summary, this is a case of tuberculous pericarditis with the pericardial sac being obliterated by necrotizing granulomatous inflammation composed of epithelioid granulomas with central amorphous granular necrosis, a cuff of viable epithelioid histiocytes, and scattered Langerhans giant cells, and also with a component of fibrosis, which is deposition of collagenous tissue. Thank you.